Okay, hi guys. So we'll be talking about neoplasia, the definition, nomenclature, and classification. So basically, when you talk about the definition, so we can have tumor, which is swelling of a tissue. Neoplasia, the descriptive term, this is the one that I would suggest for you to say in your exam if you get this question. It's a persistent, abnormal, relatively autonomous, monoclonal. Monoclonal is very important. Remember to say monoclonal proliferation of transformed cells. There's also another definition that you can say, which is neoplasia, the pathogenetic one, sorry. Fundamentally, genetic disease in which there is a stepwise accumulation of genetic abnormalities combined with the evasion of immunity. Now, when we're talking about neoplastic tumors, they consist of two parts. They consist of the parenchyma, which are the cells, the neoplastic cells themselves, and a supportive stroma, which is the connective tissue blood vessels. Okay. Now, this should not be mixed with non-neoplastic growth, okay, such as malformations like hamartomas, which I'll be explaining, growth adaptations like at hyperplasia, right? And then pseudotumors like cysts, leukoplakia, inflammatory growth. Do not confuse neoplasias with these other types of growth. They are non-neoplastic growths, okay, or non-neoplastic growth disturbances. Now, when we're talking about nomenclature, you can mention dysplasia, okay? Now, dysplasia is basically an abnormal cell maturation or growth. One very important thing to remember is that dysplasia is reversible and it is a pre-neoplastic change. It is not neoplastic, it is pre-neoplastic change, showing abnormal. Now, what we see is that abnormal patterns of growth. We will see different architecture of the cells. We would see different maturation of the cells, right? Each cell is different. Okay, it is often called intraepithelial neoplasias as well. So we can say cervical intraepithelial neoplasia or prostate intraepithelial neoplasias. Now, dysplasia is not yet invasive. Now, in the picture, you can see that there is a basement membrane. The cells are not beyond that basement membrane like in the case of cancer. That's why dysplasia is not invasive. Okay, it is not yet invasive. They lie above the basement membrane and do not involve the full thickness of the epithelium. However, dysplasia can go on to carcinoma in situ. Now, what is carcinoma in situ? Carcinoma in situ is here. Carcinoma in situ basically means that the neoplasm has spread in the full thickness of the epithelium, but it is still not invaded the basement membrane. Okay. Carcinoma in situ is not reversible. It is irreversible. Once you're at carcinoma in situ, there is no going back. Carcinoma in situ, however, can progress into invasive carcinoma, in which case the neoplasm will invade through the basement membrane, and now you're in invasive carcinoma. The next term that you should be familiarized with is anaplasia. Anaplasia is the degree of undifferentiation of the cell. Now, why do I say undifferentiation? Our cells that are in particular locations are differentiated. They are specialized cells, right? When we're talking about anaplastic cells, they are not differentiated, right? They are they are not suitable for that location, or we can say that they are not specialized like our other cells, like our normal cells. Now, there are some exhibits that we have to take into concern. For example, pleomorphism. Okay, various cells having odd shapes and sizes, like we can see this anaplastic cell. Or orientation, there's no clear pattern, each with a different apex, if at all. Here we can see two apexes, right? Apices, sorry. And then we have the nucleus. The nucleus, there can be a change in the ratio, like nucleus to cytoplasmic ratio. Normally, what do we have? We have a higher cytoplasmic ratio. But in some cases, what happens is that the size of the nucleus would increase and we would have a higher nucleus to cytoplasmic ratio. Or for example, we will have hyperchromatic nuclei or prominent, or we will have a prominent nucleoli, right? Then we can have proliferation. Proliferation is when we have many mitosis and we have odd mitotic figures, right? So this is basically anaplasia. Now the reason that anaplasia is very important is because it is a scaled property and is a determining factor when grading tumors. One important thing is that do not confuse grade with staging. Grade is based on anaplasia, based on our anaplastic cells. What is the degree of undifferentiation within them, right? So here we can see well differentiated, moderately differentiated, poorly differentiated, undifferentiated, and based on anaplasia, we're basically doing the grading, right? Okay. Next, we can go on to the classification of neoplasias. Neoplasias can be classified based on according to three things. Either they can be based on the organ, where the particular cancer is occurring. Is it lung? Is it liver? Or it can be the biological behavior. Are they benign, borderline, malignant? Or it can be histogenesis. Histogenesis is it a mesenchymal, hematopoietic? Is it epithelial? Is it neuroendocrine tumor? Neuroepithelial tumor? Is it germ cell tumor? Is it mesothelial tumor? Is it mixed tumor? So um, histogenesis is another thing. And histogenesis is a main part of typing a tumor. Now, because of, these classifications that we have, we can actually get a nomenclature rule for the tumors based on which tissue type they are, right? Now, for example, when we're talking about epithelial tumors, okay, epithelial can be two divided into two major subtypes. Okay, we can have glandular or we can have squamous. Benign is called adenoma. Malignant will be adenocarcinoma. Squamous will be squamous papilloma. Malignant will be squamous cell carcinoma. Okay, we talked about the epithelial tumors, but we also have mesenchyma, right? In histology, you would study that there are two different tissue types. So when we're talking about mesenchyma, or we say mesenchymal tumors, we would say osteo, ost, a benign osteoma, which is similar to epithelial, but when we're talking about malignant, it's different. It will be osteosarcoma, not carcinoma, it will be sarcoma. If it's blood vessel, angiosarcoma, lymphangiosarcoma, right? So fat would be liposarcoma or lipoma, right? So these are different, we can say, classifications that we can do. Furthermore, we also have lymphocytes. In the case of lymphocytes, please remember that there is no benign. It does not exist. We only have malignant, and it can be either lymphoma or leukemia. You will be classifying this later. You'll be learning about it. Then we have melanocytes, which is nevus, and then we have the melanoma. Okay. Uh, After this, let's go back to some other nomenclatures which are not neoplastic growth disturbances. As I said, do not confuse the neoplastic with non-neoplastic. So I'll be mentioning some of the non-neoplastics as well. Okay. So we have malformations and we have some adaptive changes. Malformation would be like agenesis or aplasia, for example. This is a complete lack of the development. Okay. Now let's talk about hamartia and hamartoma, or choristia and choristoma. Hamartia is a small one, hamartoma is a larger one. These are benign, disorganized, but well differentiated tissues which are native to the site. What do I mean by native? Means that this is a normal site where they're supposed to be present. So you can see in the picture, they say abnormally arranged tissues present at a normal site. So the cells that are present over there are normal. They are normally present there as well. But when we're talking about choristia, which is small, or choristoma, which is large, benign, disorganized, well-differentiated tissue. Please remember that it is disorganized, right? That is what we mean by abnormally arranged, or you can say abnormally arranged or disorganized. But they are well-differentiated tissue, but they're ectopic to the site, right? So, like we say, ectopic pregnancy, right? They are not supposed to be present in that location. Those cells are not supposed to be present there. So we have pancreatic chorestia in the duodenum. Okay, so this is obviously um, a disorganized, well-differentiated tissue, ectopic to the site. When I said ectopic pregnancy, do not relate it to a choristoma. That's not a choristoma. All I'm trying to explain is that ectopic means that it is not normal in that particular site. It is not normally present there. It is present at a different anatomical site. Okay. Let's move on to adaptive changes. Now, when we're talking about adaptive changes, you already know hypertrophy, hyperplasia, atrophy, pseudohypertrophy. Again, do not confuse these with neoplasia. And then we have metaplasia. Now, metaplasia and dysplasia are commonly confused. When we're talking about dysplasia, we say that there is a transformation of a cell into an abnormal version of itself. So initially, when I mentioned dysplasia is something that is like the cells are becoming architecturally and we can say their architecture is completely different from the normal cells, okay? Or their maturation is basically different from the normal cells. But when we're talking about metaplasia is when the cells are transforming from one form to another form, okay? What this means is that, for example, okay, we have ciliated columnar epithelium of the respiratory surface becoming into stratified squamous epithelium. Our body is always trying to adapt to the stress, right? This is also our body's way to adapt to a particular stressful stimuli. For example, Barrett's esophagus. We know that this occurs in GERD. Why is this occurring? What happens in this? In Barrett's esophagus, we normally have stratified squamous epithelium that is present in the esophagus. Okay, in the lower esophagus, we have stratified squamous epithelium. This stratified squamous epithelium is replaced by a columnar epithelium of intestinal type with goblet cells. Why? Because our body wants to protect against that acid that is present. So it'll start to become, we can say, a columnar epithelium with goblet cells, right? So this is metaplasia, and metaplasia can also be seen in the uterus, within the cervix, and we can also see it in we can say the respiratory system, right? Because of smoking, for example. So there are many examples of metaplasia, but you will be learning this more in detail. So metaplasia and dysplasia are different. Just make sure you remember that. And yeah, that's it. Thank you so much.